Hello, it's Dr. Rhonda Johnson. Today is Sunday, June 27, 2021, and today I'm going to be discussing why I'm going to continue to wear my face mask. Well, on Friday, June 25th, the World Health Organization urged fully vaccinated people to continue wearing their mask, continue socially distance, continue washing their hands, and avoid highly crowded places. And this is because the Delta variant continues to spread rapidly across the world, and it's highly contagious. According to experts at the World Health Organization, vaccination alone won't stop community transmission, and people need to continue to practice these prevention measures, especially in communities where ongoing transmission of COVID is occurring. Now, this is in odds with what the CDC is saying around fully vaccinated people, and I want to acknowledge that. However, the United States hasn't vaccinated enough people to stop this Delta variant from continuing to infect people, and especially in communities where vaccination is very low. Public health experts say that these people are highly at risk for COVID. Now, preliminary data, which is very good, from England and Scotland suggests that people who are infected with the Delta variant are twice as likely to end up in a hospital compared with those infected with the Alpha variant, and that was formerly called the UK variant. And we know that the Delta variant is spreading extremely fast here in the United States and is on track to become the dominant variant of the COVID virus. So I will share some information that from an article that I read from a former director of the CDC, who I felt offered very practical advice around mask wearing. And it's to consider who you are, where you are, and what you're doing. So who you are has to do with the state of your health and the state of health of people around you. If you are an individual who has a lot of high risk medical conditions, you could have heart disease, you could have asthma, you could be over the age of 65, you could have obesity, diabetes, you could be immunosuppressed from cancer or other immunosuppressing conditions like lupus. Again, these folks, according to the former CDC director, should continue to wear masks. Now, where you are, not all communities have the same level of vaccination coverage. And remember that children under 12 have not been vaccinated. And many of us have family and friends who refuse to be vaccinated. And when you're out in public, folks, it's difficult to know who is and who isn't vaccinated. And certainly when you're traveling outside of the U.S. and Europe, remember, vaccination rates are very low in countries that you may be visiting. So also remember that indoor events with poor ventilation and more people are very high-risk settings, especially when you don't know who and who is not vaccinated. And these can include indoor bars, indoor restaurants that are crowded, indoor sports events, indoor gyms, indoor religious services, indoor graduations, indoor parties. Folks, wherever people are shouting, singing, or breathing hard, even if you're fully vaccinated, in particular if you are at high risk for COVID and COVID complications, you may want to wear your mask. And then also think about what you're doing, because again, different activities bring about different risk. And if you're doing an indoor activity that generates a lot of aerosols, And remember what an aerosol is. How they're generated is by routine talking, singing, shouting, or heavy breathing by exercise. And remember, respiratory droplets are generated by sneezing and coughing primarily, and the coronavirus is spread through aerosols and respiratory droplets. Where the air movement is stagnant, where there are no open windows, where you're in a crowded indoor place with poor ventilation, these are high-risk situations for transmission of the coronavirus. Now, we know that these vaccines are highly effective, even against the Delta variant. For example, the Pfizer full dose vaccine means you've had 2 doses and you're 2 weeks out, is 88% effective even against the Delta variant. But none of the vaccines are 100% effective against the virus. So remember that. And as for me, I'm going to continue to wash my hands. I'm going to continue to physical distance. I'm going to continue to try to go to activities that are outdoors when possible. And I will be wearing my mask when I'm in grocery stores, when I'm in any kind of public place that I don't know who's vaccinated and who isn't vaccinated. And people may look at you a little strange, but it won't bother me at all. I know that I have age and health risks that place me at higher risk for COVID complications, so it's a simple choice for me. Do what's best for you and your family. Remember to consider who you are, where you are, and what you're doing. That's my message today. It's Dr. Rhonda Johnson. As always, my views are my own, and my only intent is to help save lives and help people to continue to live healthy, even during this pandemic. Stay safe, folks, and have a blessed day.